This EEG and sleep is very important because recently from this EEG and sleep's learning memory and the language and speech questions are regularly asked. So coming to EEG, what is EEG? Just like we know ECG, it is an electroencephalogram. Here we are recording the potentials of the brain. So this is recorded. So suppose if you place some electrodes above the scalp, it is called as electroencephalogram. Suppose during a brain surgery, sometimes we can place it over the pia mater. This pia mater, if you place the electrodes over the pia mater, then it is called as electrocorticogram. So, but basically we do this EEG only. This EEG, clinically it is very, very important for seizures. But physiologically, it is important for the sleep studies. The various stages of sleeps are indicated by this EEG waveforms only. And it is the recording of dendritic potential. It is the recording of dendritic potential. And it was identified by a scientist called as Hans Berger. That's why these waves are also called as Berger waves. So these waves are called as Berger waves. And there was a recent MCQ wherein they associated this Hans Berger and asked one question which is related to the learning and memory. What was the question is, the students was in the Viva and he was asked what is the name of the scientist who has identified EEG waves. The student was not able to answer. So the examiner, he gave a clue. This was from AIMS. The examiner gave a clue that it is more related to McDonald's. Suddenly he answered Hans Berger. So what has happened? The examiner has given a priming impulse. So whenever any priming is given, that is called as priming type of memory, which you'll see in the memory. So the answer for this was priming. The examiner primed him saying McDonald's. McDonald's, all of us remember it is burger. So then from the term he remembered burger. So this kind of priming memory was asked in the exam of AIMS recent paper. Now coming to the various waves of EEG. There are several waves of EEG like the PQRST, we have it in the ECG. Here we have written the waves on decreasing frequency. The frequency here is decreasing and the amplitude is increasing. I would suggest you to remember the same order. So the mnemonic for this is G, BAT, D. You just remember BAT comes together. G and D. So G is for the gamma waves. They are the highest frequency. They have the highest frequency and lowest amplitude. So when you will be in gamma, suppose if you are listening to this lecture and you are paying your maximum attention, because questions are recently asked from this. So if you are paying maximum attention to the the educator, then what happens? There will be gamma wave production in the brain. So that is called as focused attention. Focused attention. Then whenever the attention is little less but some attention is there, then the person is in the beta wave. So this is the awake state or wakefulness state. And this specifically happens in the paretofrontal lobe. These waves are seen in paretofrontal lobe. And whenever the person has closed the eye, if the lecture is very boring and finally the person is closing the eye, if they are closing the eye but not slept, the person is awake but eyes closed. So in that, what waves will be produced? Alpha waves will be produced. And they might give you a question also wherein they will give an alpha wave. Finally, they will indicate it with eye open. So alpha waves is produced whenever the eye is closed. After eye opening, what will happen? The frequency is going to increase and it will form the beta waves. So this phenomena, they can ask you what is this phenomena? It is nothing but the alpha block. And here the alpha is converted to the beta waves because he has opened his eyes. So alpha waves happens whenever the person is awake, he has not slept but eye closed. This predominantly happens in the pareto-occipital lobe. First is paretofrontal, next is pareto-occipital. Pareto-occipital lobe. Then finally coming to the next wave, that is theta wave. Theta wave, usually it is seen in the transition from wakefulness to the sleep. But otherwise it should not be seen. So this is the transition. If it is seen in the transition, it is acceptable. But if it is seen in an otherwise normal person, a person who is awake, then it means that there is an organic brain damage. There is some brain damage. And finally the delta waves, which is in the deep sleep. Suppose you have slept completely after your post lunch, then it is the delta wave that is going to be produced, that is deep sleep wave. Here you can see the frequencies. Gamma, whenever the attention is more, so we are going to do a focused attention. So gamma waves will have the highest frequency and they keep on declining towards the end of the deep sleep. In deep sleep, The frequency will be less, but the amplitude will be very, very high. They are inverse of each other. Whenever the frequency is more, it will form multiple short waves like this. So this is the classical waves which can be seen in a normal EEG pattern. Now, what is the sleep and its types? So for the recording of sleep, this EEG wave is very, very essential. So the sleep is basically classified into two different forms based on the recording of EEG, EOG. What is EOG? Electroencephalogram. Oculo means eyes. Electroencephalogram. Then EMG. EMG is the activity of the muscles. This studies is called as polysomnograph. The EEG is been widely studied for sleep studies, and this study is called as polysomnography. Not only this, they will also take ECG as well as the SpO2 monitoring levels also. But majorly the sleep is classified into three based on these activity. They are classified into NREM sleep and REM sleep. What is NREM sleep? It is non-rapid eye movement sleep. Then what is REM sleep? It is rapid eye movement sleep. So non-rapid and rapid eye movement sleep. This rapid eye movement sleep, sometimes when you observe your partners or anybody at home, there will be continuous flickering of the eye movements. That's why it is called as rapid eye movement sleep. Now coming to the NREM sleep. This NREM sleep, it is also called as orthodox sleep. It is also called as orthodoxical sleep or slow wave sleep or a quiet sleep. Here why it is called quiet sleep? Because there is not rapid movement of the eyes. So that's why it is called as quiet sleep. And it has multiple stages. Initially the stages were classified as 1, 2, 3, 4. 4 stages were there. But right now the classification is changed. They just classify it N1, N2, N3. N indicates NREM. Since this stage 3 and 4 were having very similar features, they have clubbed them together. So that's why it is called N1, N2, N3 now. So what happens in N1? So there is a transition of sleep. The person is awake. First what we have to do? We have to close your eyes and then you have to just pause on to sleep. Whenever you close your eyes, what waves will come? Alpha waves will become. So alpha waves will come. Then alpha to theta, there will be a transition. So this transition will happen, alpha to theta. Then N2 is the first true stage of sleep. In N1, the person is not at sleep. In N2, it is the first stage of sleep. They saw that in N2, what was happening is there were two specific findings in the EEG. And these two findings are very, very important for MCQs also. They saw a biphasic high voltage. As you can see here, I have represented. They saw a biphasic high voltage wave. And this biphasic high voltage was called as K complexes. K complexes. So this is important. And they also saw some burst of waves which was having the frequency of 10 to 14 and it was lasting 0.5 to 1.5 seconds and 50 to 100 microvolts. This burst of waves are called as sigma waves. This sigma waves were also called as sleep spindles. They were also called as sleep spindles. So this second stage of sleep is very important. Two findings are there. One is the sleep spindles and K complex. Sometimes they can show you an ECG and if they show you a biphasic wave, then it is more likely a K complex. So that is important. Now from the sleep stage, we are going to deep sleep. Deep sleep, what wave will come? The delta waves. The delta wave is going to finally appear in the deep sleep. Now coming to the REM sleep. What happens in case of a REM sleep? Already we know one feature, that is the rapid eye movements will be there. And that's why it is called as paradoxical sleep or active sleep. Why it is called paradoxical sleep? The person is sleeping, but his brain activity when we recorded, it is showing some action and his eyes is also moving fast. So this kind of sleep is called as paradoxical or active sleep. And it is also called as superficial sleep. There is no deep sleep. Here what is happening is rapid low voltage wave resembling an awake state. It looks, whenever the EEG is seen, it looks as if the person is completely awake. And it has one very important spikes which is called as pontogeniculo PGO spikes, occipital spikes. It is happening in the pons, geniculate nucleus, occipital regions. That's why it is called pontogeniculo occipital spikes. And it is due to the increased activity of ACH, that is nothing but acetylcholine. So this could be a potential MCQ. PGO spikes and ACH is the major reason for it. So this is the REM sleep. So what are the differences between a REM and a non-REM sleep? We'll see the REM versus non-REM sleep. We'll be seeing under the subheading that brain activity, heart rate and other parameters, muscle tone, threshold for arousal, and what is the type of dream. So coming to the brain activity, in non-REM, the person is in a deep delta wave, so the brain activity is reduced here. So whereas in case of REM, it is still active because of the PGO spikes and other activity in brain. The heart rate, respiratory BP, everything reduces here. The sexual arousal, everything reduces here. Whereas everything is increased in case of a REM. Coming to the muscle tone is intact in case of a non-REM. In case of a REM, even though we see the eye movement, but still the muscle tone is lost. It is causing hypotonia or the atonia of muscles, except in two muscles. One is the ocular muscles. Another group of muscle which we don't want hypotonia or atonia. What is that group which is essential for the survival? It is nothing but our diaphragm. If the diaphragm is going for hypotonia or atonia, then the person will die, which we don't want. Then threshold for arousal. Usually it is said that threshold for arousal is less in case of a non-REM. Like the person can be waked up easily. In REM sleep, it is very difficult. The threshold is high. Threshold is very high. Coming to the dream aspects, the REM dream is shorter and it is usually based on current life events. Life events. Whereas in case of REM, it is longer. It is those some very hi-fi dreams we have it like we are fighting someone or we are going to a very beautiful place, something like that. These are emotional and visual kind of dreams will be there. Visual kind of dreams. There is one bad dream which can happen in both of it. One is called as the night terror. In case of non-REM, we have the night terror, and in case of REM, we have the nightmares. Nightmares. In night terror, the person will be waking up and it is difficult for the person to console, but they will go back to sleep. In the morning, they will have amnesia of the sleep. They will not remember the sleep. Whereas nightmares, they can remember. So that is the difference between a REM and a non-REM sleep. Now coming to the sleep disorders, sleep is such an essential thing. I'll tell you one interesting thing about sleep. The normal ideal sleep that is recommended is 8 hours. Don't go in for very less amount of sleep like 6 hours and all. 8 hours. Because sleep is very essential. What is the most important function of sleep that has been identified? Previously we were thinking it is for the energy rebalance. But right now the most important function of sleep is memory consolidation. Consolidation. So whatever you have studied in a short term, they have to be put into your long term memory. Short term, you can read it and directly write in the exam and forget. That can be done. But if you want to retain it for a very longer time, what you have to do is you have to have an adequate sleep, because memory consolidation is now the most important function of sleep, and this happens during a good amount of sleep, not broken sleep. Now, this kinds of sleep disorder, and sleep is implicated in various disorders. Even in Alzheimer's disease, if the person is not sleeping properly, there will be an early onset of Alzheimer's also. Because all the metabolites that is produced by the brain, they have to be taken out and they have to be excavated in the sleep only. The sleep disorders will happen whenever the person is not sleeping properly. So they are grouped under two groups. One is the parasomnias, another one is dysomnias. What is parasomnia? Parasomnia means it is any abnormality during sleep, like during sleep or waking up or going to sleep. This is the abnormalities which is happening during the sleep. Whereas dysomnia means the sleep itself is affected, like quantity, quality or timing of the sleep are compromised. So what are the parasomnias? We have bruxism. What is bruxism? That is teeth grinding. The patient will be grinding his teeth. Then enuresis, night wetting or bed wetting can happen. Then sleep talking. Like the what is that called as? It is called as somnology. Otherwise, sleepwalking. What is this called as? Somnambulism. Somnambulism. So all these things can happen in case of a parasomnia. Then periodic limb movements. Sudden limb movements can be there in the person. When it comes to dysomnias, like now here the quality of sleep or the quantity of sleep itself is affected. They will have insomnia. So if their sleep is disturbed, they will not be able to sleep properly back again. Then hypersomnia. Some people keep on sleeping for a very long time. Then narcolepsy. If the night sleep is not proper, what will happen? There will be an excessive daytime sleepiness. That is called as narcolepsy or sleep apnea. So all these things are called as dysomnias. Not only this, even during jet lag, what happens? There is a lag in the sleep and suddenly the person can enter the REM sleep also. Usually the cycle goes from non-REM to REM. It will go from N1, N2, N3, then back to N2, N1, then REM. and this cycle keeps on happening every 90 minutes. So it will happen for 4 to 6 cycles during a normal sleep. So this is the pattern of sleep. In case of a jet lag person or who has not slept properly, he will directly jump into the REM sleep, which is bad because arousal from the REM sleep is difficult and paradoxical. It is a paradoxical sleep. We need a good amount of REM and non-REM both. Now, treatment of sleep disorders. So, what is the basic treatment of sleep disorder? Light therapy can be given. Then, rameltion. There is the most important hormone which is involved in the sleep, that is melatonin, which is produced by the pineal gland. The pineal gland produces this melatonin, and this melatonin is essential for sleep. If it is not present, then obviously the person will not sleep properly. This can be used in the treatment. Lamentian is the modified version of it. Then there is a drug called as zolpidem. There is a drug called as zolpidem, which is involved in a sedative hypnotic. It is a sedative hypnotic which can be given to the patient. Then modafinil. It is a drug given for narcolepsy. So these are some of the treatment options which can be given for the patient of sleep disorder. And sleep is very, very essential. Take it from me. If you sleep properly, you can avoid a lot amount of diseases, a numerous amount of disorders.